Hello, this is Dr. Ankur Hazarika. I am the Chief Consultant and Head of the Department of Orthopedics at GNRC Hospital, Guwahati, Assam. I've been the consultant of this hospital since last 15 years, and my expertise or my field of interest would be orthopedic trauma and arthroplasty or joint replacement surgery. Now, today here we are to discuss about the importance of musculoskeletal health, which is very important nowadays, as we all know, after this COVID pandemic situation, or we are still in this COVID pandemic situation. So we have to understand few things. If we ask what is the importance of musculoskeletal health, then we can say that musculoskeletal health plays a key role to keep up good mobility and dexterity in an individual, along with enhancing their ability to work and actively participate in all aspects of life. Good musculoskeletal health is also crucial to maintain economic, social, and functional independence across their life course. Physical activity has a crucial role in reducing the risk of other non communicable diseases, and it can only be achieved with adequate musculoskeletal health. Now, the next question might be, what is the relationship between painful musculoskeletal conditions and reduced capacity to engage in physical activities? As we all know, impaired musculoskeletal health can lead to acute or chronic pain, causing physical limitation, proceeding in loss of participation and withdrawal from usual social, community, and occupational activities, further decreasing the quality of life and well being, including mental health. Impaired musculoskeletal health can lead to substantial personal, community, and societal consequences, particularly in elderly people. A strong relationship between painful musculoskeletal conditions, lack of physical activity resulting in functional decline, frailty, loss of well being, and loss of independence, as well as depressive symptoms, has been described by several epidemiological studies. An individual with an arthritis and a musculoskeletal disorders is sure to be lesser active than an individual without it. Thus, a lack of regular physical exercise emerge as the most prevalent risk factor associated with functional decline. Most important, impaired musculoskeletal health causing reduced physical capability with like grip strength, walking speed, chair raising, and standing balance have been frequently linked to increased mortality. Thus, weak musculoskeletal health is a key component of frailty. What is the impact of impaired musculoskeletal health? The impact of impaired musculoskeletal health is now recognized globally, with an increase in morbidity and mortality related to it. Good musculoskeletal health is crucial for maintaining an active, productive, and prolonged working life. With an increase in global retirement age, maintaining good musculoskeletal health has become increasingly important for older workers, as many occupations and work related activities are associated with musculoskeletal disorders. Like low back pain and shoulder disorders, one of the commonest problems seen in workforce. Thus, it is important to identify and implement effective interventions for people with musculoskeletal conditions to remain productive at work. High income countries observe musculoskeletal conditions to be one of the major cause of work loss, early retirement, and loss of retirement wealth, while developing countries see musculoskeletal conditions to have a major impact on livelihoods. Thus, reduced musculoskeletal health results in reduced productivity and economic loss to society at all levels. Since musculoskeletal conditions are chronic, painful, associated with disability, and social disengagement, frequently causes mental health impairments such as depression and anxiety, as well as other comorbidities. Physical and mental aspects of quality of life related to health is known to be greatly impacted in persons with multimorbidity. Unfortunately, this impact is even greater when there is associated musculoskeletal conditions. This pandemic has taught us that if a person has to remain confined in his homes for a long time, patient because of lack of physical activities, musculoskeletal health, the patient can have a lot of psychological issues. So, what is the burden of musculoskeletal disease related to these conditions? Non-communicable diseases now account for most of the global burden of disease, with musculoskeletal conditions being the leading contributor. Developed countries well recognize the transition of burden to long-term disabling conditions. However, now low and middle income countries are also demonstrating the enormous future impact from musculoskeletal conditions such as osteoporosis, low back pain, driven by population growth and aging. Since age is the commonest risk factor for musculoskeletal condition, it is estimated that by the year 2050, there will be a 5 times rise in the people over 40 years living in developing countries, contrasting the wealthier countries. The World Bank 2011 data states this. Additionally, obesity, another important risk factor for many musculoskeletal conditions, is also hypothesized to rise dramatically in developing world over the coming 2 decades. Furthermore, increased use of motor vehicle is not only reducing physical activity, but also increasing the numbers of motor vehicle accidents, resulting in musculoskeletal trauma and disorders. Then, what is the role of physical activity and sedentary behavior in musculoskeletal health? Sustained and systemic urbanization in developed countries has led to sedentary behavior among the people, particularly younger ones. The rapid growth of legions of video games, social media, movie streaming, binge watching seems to be the prime contributor. This surge in sedentary behavior is not only a major risk factor for many chronic diseases, but also recognized as a substantial global economic burden. Increasing physical activity, optimizing exercises as recommended by Arthritis Research, United Kingdoms versus Arthritis and World Health Organization WHO is an optimal way to improve musculoskeletal health. Evidence shows that the effect of a sedentary lifestyle, example, desk job, can be reduced by a small amount of activity every day. A recent meta-analysis utilizing the data of over 1 million individuals concluded that 1 hour of moderate level activity daily can eliminate the increased risk of death associated with 8 hours of sitting. Thus, a moderate level of physical activity remains a key requirement for healthy aging and maintaining musculoskeletal health. Sedentary behavior is a major contributor to obesity and type 2 diabetes. Likewise, obesity is also a major contributor to the development and progression of osteoarthritis, with several epidemiological studies confirming the link between adiposity and joint degeneration. Evidence suggests that increasing the levels of physical activity will not only increase musculoskeletal health but also decrease the risk of suffering from obesity related disease such as diabetes. The WHO recommendations on physical activity for healthy individuals are nearly 2 hours every week of moderate physical activity, or about 20 minutes per day of any kind of physical activity, like brisk walking is recommended by WHO. These exercises elevate heart rate and are known to be associated with lower lifetime risk of cardiovascular disease. Apart from rendering musculoskeletal health benefits, improvements in cardiorespiratory fitness can be achieved by changing sedentary behavior to achieve a low intensity physical activity like walking. Exercise is now widely prescribed for the rehabilitation of musculoskeletal injuries, and its use as a preventive health measure is now widely investigated, with guidelines around the type, frequency, duration of activity being considered. Then, what should be the focus on evidence based intervention for the musculoskeletal conditions that cause the most disability adjusted against years are low back pain and neck pain can be benefited by staying active and exercising regularly, which are the commonest complaints which comes from the people who do job 9 to 5 job or desk jobs. Group exercise program or weight loss support can be considered to reduce the incidence of falls, balance and strength training, some hazard assessment, participation in falls prevention program, and getting involved in activities like gardening, dancing, etc. helps. Osteoarthritis has been found to be benefited from activities and exercise that improve muscles and aerobic fitness, like walking, swimming, Pilates, weight loss support can be rendered if required. Is there any association between healthy aging and physical exercise? Yes, indeed. Aging is inescapable. It is the ultimate truth, but it can be made easy and healthy with the help of exercise. Exercise renders many benefits to the aging body, including reducing the manifestations of aging, especially the aging phenotype of the elderly. A recent systematic study concluded physical exercise renders a positive impact on muscle mass and function in healthy subjects aged 60 and above by improving muscle performance by increasing the ratio of type 1 to type 2 muscle fibers and increasing the cross sectional area of type 2 muscle fibers. Our European Society for Clinical and Economic Aspects of Osteoporosis, Osteoarthritis, and Musculoskeletal Disease, higher protein intake in combination with physical exercise in postmenopausal women at risk of developing a menopause associated musculoskeletal disease like osteoporosis. Physical exercise programs improve strength and balance in aging women with osteoporosis. Additionally, fragility fracture risk associated with osteoporosis can be decreased by following an exercise program. As exercise increases bone density and reduces inflammatory markers, thus having an active lifestyle from an early age and following recommendations for exercise could be beneficial for women. Furthermore, exercise and mechanical loading also have a positive impact at the molecular, cellular, and tissue level. Like with aging, the potential for cell proliferation and the number of stem progenitor cell like cells decreases in tendons. Exercise loading can induce an increase in tendon collagen synthesis, thus increasing tendon strength. Physical exercise and mechanical loading also have a positive role in maintaining cartilage and bone health. Moderate exercise could also enhance the quality of tissue produced during the healing of injured tendons. Is there a relationship between obesity and musculoskeletal disease? A surge in sedentary behavior, unhealthy diets have caused global obesity epidemic along with a sharp rise in the incidence of type 2 diabetes. These are further great risk factors for cardiovascular and neurodegenerative diseases, which further complicates the management of musculoskeletal diseases. Obesity is an important comorbidity of many musculoskeletal conditions and is closely related to the development of OA, one of the commonest musculoskeletal health issues. OA is osteoarthritis. The strategies aimed at reducing obesity in adults will reduce the occurrence of osteoarthritis and thus can alleviate some of the pain of the condition. Interestingly, obesity is also one of the most modifiable risk factors of osteoarthritis. Exercise and weight loss have been benefited with overweight and obese adults with knee OA in many clinical trials. Thus, combining modest weight loss with moderate exercise can provide the best overall improvement in symptoms of pain and joint function. What are the consequences of childhood obesity and physical inactivity? Lack of physical exercise in childhood causes childhood obesity, which further leads to musculoskeletal pain in later life. Thus, reducing obesity in children, encouraging physical activity will also reduce the risk of developing musculoskeletal pain later in life. Furthermore, consumption of unhealthy diet, sedentary lifestyle contributed to the increased incidence of childhood obesity. Low in nutritional value, high in caloric content food further contributes to the obesity epidemic, which may also play a role in high prevalence of type 2 diabetes and cardiovascular disease, which are further exacerbated by a lack of fitness and by inactivity. So, does diet also have a part to play in healthy living? How does it affect the musculoskeletal health? Yes, diet is inevitably an important part of healthy living. A 3-year follow up study, including about 400 adults, showed that diets high in potassium from fruit and vegetables intake reduced the amount of muscle loss in adults more than 65 years. Dietary flavonoids intake from fruit and vegetables is also known to be positively correlated with good bone health, that is, bone mineral density and bone resorption in perimenopausal women. Improving the diet of osteoarthritis patients have also shown great benefits. Vitamin D, calcium, and particularly protein consumption have been shown to optimize muscle, bone, and functional outcomes in elderly people, reducing fall and fractures. Calcium and protein synergistically optimize bone health. Thus, dietary strategies for improving musculoskeletal health should include consumption of long chain fatty acids, vitamin D, NK, helps in bone and cartilage mineralization and decreasing blood cholesterol. Antioxidant-rich food may benefit athletes by improving tissue repair. Sarcopenia in elderly people can be benefited by combining exercise with dietary supplement of whey protein fortified with vitamin D as it increases muscle mass and strength.